What got me interested in being a physician was back when I was in the Army. I was a medic then, and I really wanted to go on and do a little bit more training. I thought about being several different things, but I focused in on being a physician. It seemed like I could, really bring a lot to the field. I also thought that I could, just be more in charge of like the everyday decisions. So that's what got me there. What got me to be a psychiatrist is I just love talking to people. I love hearing people's stories. I think that the stories that we tell about ourselves or tell about others are what really makes each of us unique. I think the moment I knew that psychiatry was for me was back in medical school, and it just was that we did not have enough time to talk to each of our patients, but it felt like if we did, especially when you're a medical student, you have a little bit more time, you get to like the root of maybe why they didn't take their medicine or why they didn't really want to do a certain procedure. And being able to talk to them a little bit longer actually got them better help in the long run. And so psychiatry is one of those fields where you do get to talk to your patients, you get to spend a little bit more time with them. And so I feel like that helps people out more than just maybe the fast-paced world that we have right now. Common misconception is that we do just not listen to you, and still, even though I went into psychiatry to listen to people, I think that people get the preconception that they're just going to go tell their problems and get a medication. I don't know that medication is always the answer, and it's not always the answer that we just have to do something at each visit. Sometimes just talking through things, getting to know you, and figuring out your problems is the best course of action. I think my philosophy when helping people with their mental health issues is to really align myself to whatever the patient wants to actually do. I don't think if I propose a treatment or a plan and they're not 100% behind it, that it's going to work. Really, it's a collaboration between the patients and myself to figure out what is the best thing that they want to do out of the available options that I think that could help them. I think I'm most excited in the field of psychiatry about interventional treatments when it comes to patient care. Take this TMS machine. TMS treatment has been around since the 80s, but it's been slowly gaining traction over the last few decades. Right now, I think it's not utilized as much as it should be. It should be standard everyday care that we just offer our patients. And so I think going forward, really making sure that it's not only medications are offered to our patients, but just all the treatments available would be the best thing going forward in psychiatry. Breakthrough in psychiatry will be probably making TMS more accessible in terms of just walking into the PCP's office. Ultimately, I want to put myself out of business. And I think that, while people need to come and see me for their problems or for whatever ailments they're going through, I really want to make sure that some of these treatments are available everywhere. And so I think in the future, things like TMS will be available just at the PCP office level.